Okay, so kind of excited. I'm embarking on a new journey. I want to take you guys with me on this journey. Okay, it finally came. So I mentioned in another video that I was going to be starting Semorelin. So this video today is about. It's going to tell you. I'm going to show you what I got in this package, where I got it from, how much I paid for it, and what exactly is Semorelin and what are the benefits of it, what are the side effects of it. Let's get into it. So I'm gonna try to move this as quickly as I possibly can. First thing first is, let's get into the packaging. This finally came today. I literally ordered this March 18th and it just arrived. I have never used Amble before. I know that when I did place the order, it hit around the same time that all that stuff happened with the compounded. So I'm gonna give them the benefit of the doubt that was the delay with me receiving this package, because it literally just got here today and it was ordered on March 18th. So that's a long time. I'm not sure if that's typical. Anybody who knows can tell me. But I did not plan to take that long to get here. So I kind of was excited about, I'm 53. Have a lot of things going on. I lost a lot of weight, over 65 pounds on GLP-1. I'm also on Lipo B and C, which is the MIC injections through Invo. I was talking to my girl Sharon. She actually is on the Semorelin journey too. She's talking about her issue, that it felt a big help with her stomach. So for me, I've had a C-section, so this is one of my issues. My knees are hurting me really bad, all the things of aging. So I'm going to talk about the benefits of what this should do for me, but let's first see what came in the packaging, okay? So it says fragile, handle with care. It's a pretty nice size bag, as you see here. So let's just open it and see what we got. I got it packed pretty good here, but I paid $155 for this. And I'll see what it says about the orders and how often to take it. I think so. One of the things that did kind of throw me back is that it's at least 5 days a week injection. So it's subcutaneous, and it's okay. So here we go. Look like I have everything that I possibly need. Okay, and then this, for you guys who don't know, this just is on ice. So hopefully it's going to tell me how to keep it. I'm not sure if I need to keep it on the refrigerator, but since it came on ice, I'm going to assume that it needs to be refrigerated. Okay, so let's look at it. This is the packaging, y'all. Oh my goodness. Okay, so Semorelin. So what it says on the front is, read before removing medication. Scan the QR code to review storage instructions for your medication. Proper storage is essential, and all that thing. So take a moment to ensure. Okay, so that's fine. I'll figure out that. We figure out that part. So first thing first is coming out of the bag is the vial. Okay, so this is from Boothwin Pharmacy. It just says inject 0.1 to 0.2, which is 10 to 20 units, subcutaneously 5 to 7 days per week. So I guess it's your choice how often you want to take it. So Semorelin, it comes 2 milligrams per milliliter, and no refills. So I'm trying to see how long. It's good to May 2nd. So I'm going to assume this is a 30-day supply. Yeah. Okay, cool. Let's look at it. Okay, here we go. So this is what I'm getting when I bring it out of the container. Let me make this a little bigger for y'all. Semorelin. Okay. All right, y'all. Okay, so we're going to talk about all the things, okay? First thing first is what came out the vial. Look at that bag real quick, so we can see what else we got here. Okay, so we give me 20 alcohol swatches. Okay, so we got alcohol, 20 needles. Obviously, it's a lot of injection. That means a lot of needles. So they give me 3 packs. Okay, that's pretty cool. And then we have the subcutaneous injection guide from Boothwin Pharmacy. So it pretty much tells you how to draw it up. All the instructions here. I'm gonna lay it there for a second if you just want to screenshot that for a second, just to kind of see what they say. But overall, quick thing is it says sub-Q. Let's get started. Ensure you are using a syringe with needles suitable for sub-Q injection. We know that we're gonna clean the vial, know how to do all that. They just telling me how to give a sub-Q injection. Okay, I'm a nurse. I definitely know how to do that. So, excuse me, I also take MIC injections. I also take GLP-1 name brand Mounjaro. So I'm very familiar with how to take the injection. Now I'll scan the thing to see about if it has to be refrigerated or not. I'm pretty sure it has to be refrigerated or it wouldn't be in the when it came out ice. Okay, so this is pretty basic. Okay, so let's talk about Semorelin. So we see what we got. 5 to 7 days a week. I'm gonna take an injection here in a second so we can see what we're getting. But let's talk about Semorelin real quick. Okay, so Semorelin is a peptide. First off, so I took a couple things I wanted to kind of go over with y'all. So we can talk about what Semorelin. So one of the questions I want to cover is how long can you stay on Semorelin? Okay, how and why Semorelin can be taken indefinitely. So Semorelin can be taken indefinitely because it doesn't have any negative long-term effects. In fact, some studies have shown that it can actually improve quality of life and increase lifespan. That's good, right? It's supposed to be really good. It's a peptide, meaning that let me tell you. I didn't even really just recently learned what Semorelin, what it was. I still didn't really know even as I was getting ready to order it, so I wanted to do a lot of research. So I researched it because all the people that I see, nobody really talk about it in depth, and I know people have questions, and I want to know exactly what I'm doing and what I'm taking, so hopefully I can help you if you're considering this, okay? So Semorelin is a peptide, and these are pretty much amino acids that they function as hormones, okay? Neurotransmitters, it says, regulates various bodily functions, including blood pressure, metabolism, and immune responses. So that's kind of what a peptide does, okay? So that's kind of what that does. Now let's talk about, because I'm just going to give y'all the 411 about Semorelin and what we're talking about, okay? So the benefits of Semorelin, first of all, it stimulates the growth hormone. So the growth hormone, the benefits of it though, let's talk about that first, is anti-aging. So clearly what I'm taking, which it clearly says is really, really good with, reversing all the things that causes us to age, okay? It increases growth hormone levels, which promotes cell regeneration. It improves skin elasticity, collagen, and production. So why that's really beneficial to me, because I just recently lost 65 pounds. I was 205. I'm currently between 138, 141. And so another thing I've been talking about is losing so much. Overall, the lipo has helped me maintain lean body mass, but the collagen in my skin, elasticity, just those things would be really helpful to help me, maintain some youthfulness about myself. Okay. Okay, so I got to stuff it down. Body composition, it stimulates muscle growth and fat burning, so it does stimulate fat burning, which I hope it doesn't for me. We're gonna be monitoring this thing together, because I want to watch my weight, because I'm going to continue with my GLP-1 and my lipo, so I'm curious to see how this is going to help play into this whole thing. But I don't want to lose any weight. I really am at my weight loss goal, and I don't want to go any smaller, so I'm hoping. But what it does say is it leads to improved body composition and physique, so it's supposed to help me look better, feel better, snatch better, so that's good. Let's see. And I told y'all again the issue I got with my stomach right here, which is from the C-section I had. So even though I lost a lot of weight, I still got that skin there that I'm hoping that can help snatch that in some. Anything will be better at all at this point, okay? I'm not going to have surgery for it, which is I need a pennilectomy and all the things, and I'm just not going to go have surgery. So it's good for bone health, and enhances bone density and reduce risk of osteoporosis. Let's talk about that, because your girl, your knees is sometimes so, it takes me even a minute to sit down. My knees be bothering me so bad. That is another reason why I really was like, let's go ahead and take this, go out here and see if this is going to really help me with that. So hopefully the knees will be better. Overall, I do have a lot of bone aches, so that would be nice to see, because the age is aging, okay? Okay, metabolic health. It helps with increased insulin sensitivity and decrease. Okay, so before it cut off, it said it increases insulin sensitivity, which is good, and it decreases blood sugar levels. So if you are somebody whose blood sugars are running low, you might want to be a little conscious about your blood sugars. For the most part, mine are stable, so hopefully I don't have any issues with that. Cardiovascular health. I'm just touching on what it overall does for us, because a lot of people don't know. I didn't, even in videos I watch, people just talking about some more than they take it, and they don't really say much. So cardiovascular health, it may strengthen heart muscle and increase cardiovascular function. Like, y'all, this is really some good stuff from what I've been reading, okay? Cognitive function, it helps enhance memory, focus, and mood. Like, this sounds like it should be amazing, right? All the things is super positive. So primarily used to, so this is the actual use of Semorelin, what its initial use is for, primarily used to treat growth hormone deficiency in children and adults. That is what it was initially made for, okay? Off-label though is anti-aging therapy, body composition improvement. So this should be making their body tight and right and doing all the things, right? So it's only a prescription medication and should be used under supervision of a physician. So you should have a physician. I ordered mine through Amber Health. I had to, so basically what I did was I put in a request. I went on the website, requested the medication. They had a doctor reach out to me, and they just, I guess they was wanting to know, they asked me a few questions. They pretty much told me what to expect, and then the order was placed, okay? That probably took 24 hours or so. It was less than 2 days, okay? Other uses is improve wound healing, reduce fat mass and muscle mass, and increase muscle mass, which is what we want, okay? Usually, they say usually you should see results within 1 to 3 months, okay? But increase energy and sleep usually within a few weeks. Now, that was one of the other benefits, is that my sleep habits are really off. I'm up at 3 o'clock, 4 o'clock in the morning. I know part of that's part of me being in menopause. So they say you really get some better sleep. So I'm hoping that I can sleep, because, I've been getting up at 4 or 5 in the morning making videos, but I do need to get enough sleep. I'm really now not, okay? Semorelin can also aid in breaking down stored fat, particularly in the stubborn areas such as abdomen. Period. This is one of the biggest things I kind of hope for. And then some individuals report improvement in skin quality and wrinkles. Clearly, okay, y'all know I'm running a filter on here, but I do have some issues with the wrinkles, my skin and stuff like that. So I'm hopeful for this, y'all. I'm hopeful that it's gonna help, that I will 1 to 3 months, okay? So we're gonna have to keep an eye on that, y'all. That was that. I want to tell y'all one more thing about this. So I looked at some of the side effects of Semorelin, because we just want to know a full picture of what we're dealing with. I'm giving y'all all the facts, all the 411 about Semorelin. So some of the side effects of Semorelin is headaches, nausea, flushing, dizziness, pain, swelling, hives. So these are very rare, though, they say. So I just want to know what I'm looking at. And then the one more thing I want to tell y'all was, so I covered the things that I need to cover about that. We're going to go ahead and draw up, and it says 0.1, which is 10 units. So these are orange needles, are usually insulin needles, and so they come in units typically. So they're saying that you should draw up 10 to 20 units. Of course, I'm going to start off with 10 because I don't really know. I'm taking it at night, which is good, so I can kind of see how anything, if I feel anything weird. From what I hear, there's really nothing that I should predict, all from what it looks like. It's going to be mostly really beneficial for me, okay? So let's do it. Let's draw this up, y'all. I never thought I'd be taking all these injections, y'all, but we're just trying to be better, okay? So I'm going to clean the vial first. So let's open this up again. It says it's Semorelin. And this is from the pharmacy. Again, this is from Boothwin Pharmacy, okay? So first thing first, we want to clean the vial. We want to clean the stopper. So we're going to clean the alcohol. I'm going to clean that first, okay? And then we're going to draw it up, okay? So that's this. We're going to let that dry for a second. And we are going to do 10 units. So let me just show you. I always pull my plunger just to make sure everything's working well. And it says 10 to 20. We're going to definitely start with 10, okay? Because we want to make sure. I'll do an update in the morning, or maybe in 24 hours later. So maybe today is Wednesday, Friday. I'll do an update, just trying to tell y'all how I'm feeling and if I slept, because tomorrow may be too quick. Where you won't probably know by then. Let's go ahead and push 10 units of air into the vial. And let y'all see, this needle is not bad, y'all. It's a little baby insulin needle, subcutaneous. So I'm gonna push the air in there. We're gonna draw back to the 10, see what color it is. So it's clear. And we about to start this journey, y'all. Listen, you don't know what to expect, but we're gonna see today. And then I need to find out if this has to be refrigerated or not. I'll find out. I'll add that on the screen for y'all once I hit this QR code. So I might jump back in here. So we are literally gonna be doing injections every night for the most part. Okay, so alcohol. Let's see where I'm putting this at. Okay, so I'm going to put this in my thigh because I have on this gown, and that way it's just gonna be easier for me right now. I would like to have started it in my belly, but it's just gonna be easier for me to do it right here. Okay, so here we go. 1, 2, 3. And that went right in easily. Okay, let's see if it burns or anything. Felt nothing, y'all. Felt Nothing. Nothing at all. That's alcohol, that's safe. Let me get this. Get another one. 10 units. So tomorrow I'll increase to 20 units, but just because when you start a new medication, we should, you know, just start it off just to feel a little bit of a burn now, but it could be the alcohol hitting that injection site, because I didn't feel anything going in at all, but just a little bit of burning now, but I'm definitely thinking that might be the alcohol because I have an opening in my skin. So here we go, y'all. Stay tuned. We on a journey. I gave y'all all the 411 about Semorelin and the benefits. So we shall see in real time what it does. Talk to y'all later.